The country that I chose to do my research project on is the country of Sweden. Sweden is located in northern Europe on the Scandinavian peninsula. It has a population of approximately 10 million, a GDP of approximately 530 billion per capita, and which is among one of the highest in the EU. And according to the INF, um, the Sweden national debt fell from 80% to 41% in 2017. And all three leading agencies, such as Fitch, Moody's, give Sweden a triple A rating. So their economy, for the most part, has been doing pretty good the last couple of years until I'll say the last two. But in the big picture, they've had a pretty well robust economy, good good investment. They have good a lot of manufacturing, a lot of tech jobs. So yeah, then a lot of the citizens, they're really high income earners, which is why you have statistics like this. Their healthcare, the government is it's a government funded healthcare system. The healthcare system is mainly government funded, universal for all citizens, and it's decentralized. Private healthcare does exist, but it's very small. But it has been growing actually. The government has actually been encouraging to for private companies to come in and start, offering their services. Uh, and the system is primarily financed through taxes levied by county councils and municipalities. How is Sweden's healthcare funded? Okay, so at the national level, the Ministry of Health and Social Affairs is responsible for the overall health policy. So, pretty much they're in charge of making sure that everything runs fine. They enact laws. They make sure the laws are being, you know, properly followed. At the regional level, they have 12 county councils and 9 regional bodies, and they're responsible for financing and delivering health services to the citizens. At the local level, you have 290 municipalities, and they are responsible for the care of the elderly and the disabled. Local regional authorities are represented by the Swedish Association of Local Authorities and Regulators, SALAR, SALAR. 83% of the spending is publicly funded. So once again, it's not surprising since it is a socialist welfare state. So any socialist welfare state is funded by through taxes. And in 2015, 69% of county total revenues came from local taxes, and the remaining was funded by subsidies and government grants. The principles of healthcare. So they do have principles of healthcare, and I do find this actually very appealing. Number one, the number one principle is health dignity. All human beings have an equal entitlement to dignity and the same rights regardless of their status in the community. So they don't discriminate. According to this, they're not supposed to discriminate. That all human beings are equal. You know. And number two, need and solidarity. Those in greatest need take precedence in being treated. So the the citizens who are in greatest need are taken care of first. Cost effectiveness. When choice has to be made, there should be a reasonable balance between cost and benefits, with cost measured in relation to importance in health and quality of life. So, yeah, this part I do find very interesting. They they're putting the well-being of of the citizen first, but at the same time not neglecting the responsibility to take care of the financial part of taking care of the citizen. Make sure that doctors pay, nurses, all the drugs, equipment, etc. So it's a balance, and I do find that very appealing. The benefits of the Swedish healthcare has access to medical attention available to all citizens. So all citizens have access to healthcare. I mean, if you think about it, in theory, that sounds great. Who wouldn't want access to healthcare? It's like this is my right. Equal access to all, and again, care is based on need. So you're giving it based on your need. That's how you're taken care of, and cost effectiveness. They make sure that everything's balanced. Um, they're not being overcharged. They're not that all procedures are you know reasonably priced. And another interesting uh, thing I want to point out is that the children now and adolescents, they have dental coverage from up to the age of 19. So I mean, we all know that um, visiting a dentist is not cheap. I mean, even with health insurance, I mean, you still you still have your co-pays, you still have uh, certain things that the insurance doesn't cover. That you have to pay. But the service that they offer to children and adolescents up to 19, I find it actually pretty good. I find it pretty good. And a big plus that I saw in their healthcare system is they actually give their citizens the choice to choose their provider. You would think like, what, it's government funded. It's like they they dictate how it goes. But in this case, they've allowed the citizen to be able to choose, what doctor they want to go see, what specialist, they want to go, visit, and I do find that, very surprising. But at the same time, you know what? Yeah, maybe they figured out, that they can't really just dictate everything everything to the citizen. They can't just tell them this is where you're gonna go. This is the doctor you're gonna see. They give them the choice, and I do commend them for that. The similarities between the U.S. and Sweden, well, the quality of healthcare. We all know here in the United States is top notch when it comes to taking care of its providing quality healthcare. Let's put it that way. Um, we have greatest some of the greatest hospitals, greatest medical schools, uh, pharmaceuticals, what have you. It's great. Same thing with Sweden. They have tremendous doctors out there, practitioners, what have you. They have great people who work there, and their healthcare system is great too. They have um, uh, they're big on high tech, so that's one of their strengths in the medical high tech. Another similarity is the public here in the United States would be called Medicare, Medi-Cal. Good, nice examples. They're subsidized, through taxes. And I mean, here in California, as another example, I'm sure people have heard the commercials. Cover California. Sign up by this date. You might be able to get subsidized and helped out. So that's another no similarity between the U.S. and Swedish and the Swedish healthcare system. And the last one is both have medical service to both citizen and non-citizens. So they don't. Both countries don't discriminate. I know it's a big issue. It's a touchy subject, politically. Um, but both countries, to some degree, offer um, medical services to uh, non-citizens. And here in California, we all know that non-citizens do get a lot of help through government-funded insurance. The differences between the U.S. and Sweden healthcare. The Sweden healthcare is decentralized, and the U.S. does not have one specific healthcare system. So as we've been studying, the U.S. health system is complicated. It seems like there's just different levels of departments you have to go through, and I mean it's it's uh, it's more difficult. Let's put it that way. And I think the Swedish healthcare system is just better run. The majority of Sweden's funding comes from taxes. U.S. for the most part is private funded. The majority of um, people here in the United States, it's privately funded. Through their employer. The employer pays their part, and they pay the other part. The premiums, the monthly payments, etc. The U.S. healthcare system focuses on both well-being of a patient, but at the same time, there's profits for all service providers. So, at the end of the day, the U.S. Healthcare system, there's money behind it. The owners of hospitals, if they're private, um, uh, pharmaceutical companies, um, medical manufacturers, you know, companies that manufacture equipment. So there's a lot of stuff that goes behind it. Um, that there's money involved at the end of the day. So here in the United States, it's there's the well-being, but it's the well-being of the patient, but at the same time, there's money behind it. It's just part of it, part of the system. And notice in Sweden, that's not necessarily the case. Um, even because in theory, it's it's government funded, but it's their goal is not to make money because it's a service provided by the government. So another in Sweden, their focus is the well-being of the citizen. That's the primary concern, not necessarily about making money, but the well-being of the citizen. Problems with Sweden's healthcare: they have high taxes. However, the citizens, they do find benefit in it. There's growing waiting times to get medical attention, shortage of doctors and nurses, and an influx of new immigrants to the country. So they got a stagnating economy. It's been growing. It has been growing the last couple of years, but lately it's been slowing down. Municipal finances are falling because of that. That's one of the reasons. Because the economy is slowing down. But at the same time, anytime you have too much government intervening in all these matters, it causes problems. Um, Problems with sharing data. For some reason, they do have issues with sharing data. Which I find that surprising, but they're getting better at it. Does it work? It works. As long as money's coming in. For any social system, you have to have money coming in, and it has to come in from taxes. Um, but I found this quote from British Prime Minister, the former British Prime Minister of England, Margaret Thatcher. She said the problem with socialism is you eventually run out of other people's money, and that's very true. So, and any welfare type of system, welfare state, anything that offers services to community, there has to be money coming in. If there's no money coming in, then it just doesn't work. And they're having a problem right now that a lot of people are questioning if it actually works. If it's like, is this sustainable? And there's actually uh, an article by the Economist where they're saying that that Sweden in general needs to start thinking about um, working out the problems with their social state because it's unsustainable. The money that it takes to run that is just enormous, and it's not the money is becoming harder and harder to obtain, even through taxes. You know, another another problem with it, as we were saying, is a lot of the knowledge sector jobs, like the tech jobs that Sweden is known for. A lot of them are moving to other countries because we have global economy. So companies are going to go where wages are cheaper. Not, I mean, we see here in the United States. So it's not. It just doesn't happen here. It happens everywhere in every country. So and so if you have a country that's that's solely that it's that it's solely dependent on living off the government, but the government ain't is not receiving enough funds from the citizens to taxes, when you have a problem. You have issues, and also an aging population. You know, they're you know they live longer. They have great health, so which is great. However, the longer you live, the more services you're going to need. So as their citizens, they're living longer, but it means they're using more services. And that means more money. At the end of the day, it's more money, and and inefficiencies in the public sector. So they are having issues in how they're running just the country in general, because they're just this it's designed to work as long as money's coming in, but once the money stops coming in, they start having issues. I mean, that you go through history, and you do find this history repeats itself. You look at a country like Venezuela, North Korea, uh, um, any countries who's followed, even other European countries that do have a socialist um, system. They're just running into financial issues. So you know, like I said, it works as long as money comes in. Do I think it's in theory? In theory, it sounds nice. In theory, it seems like it it'll it'll help its citizens. And I'm sure it has helped their citizens. But once, like I said, we go back to once finances start drying up, political mismanagement, corruption, whatever have you. Then the system starts taking on water. So I think um, there are some things that can be learned from their system, and even applied to the U.S. healthcare system. Would I say to completely adopt it as like just copy it? No, I don't think it would. I don't think it would be a wise decision, because our system is more complex than theirs. So, and it would cause a lot of problems. So this concludes my presentation, and I hope we all learned something new from it.